Psychiatry has always had a complex relationship to trauma. It started off as a discipline that looked at the bizarre symptoms that people have, and then they uncovered, way back in the late 1800s, at the Psychiatry in Paris particularly, that people have very bizarre reactions to trauma. And so that defined hysteria 150 years ago. And so there was some interest in it, and then they put a kibosh on it. People were no longer allowed to study hysteria. First World War breaks out. A huge number of traumatized guys have the same symptoms as these women. People come home from the First War, have a terrible experience. They're all being accused of malingering. Very traumatized people, probably had a lot to do with the rise of Nazism and eventually Second World War. A lot of effort, Second World War. And then in 1947, the last book about war trauma gets published, and there's nothing till 1982 or something. So it takes a long time. And even when I was a student, my textbook said that incest is extremely rare and it is really good for people, and it doesn't really cause any major damage because it gives women and girls permission to do something that is really forbidden, but eventually protects their mental health. And so there has been a long-term complex relationship where psychiatry really doesn't want to see trauma. And in the current DSM, what people call the Bible of Psychiatry, where my colleagues and I at the National Child Traumatic Stress Network worked very hard to get a diagnosis in, to make room for the hundreds of thousands, if not millions, of kids who get abused and neglected, whose parents go off to jail, whose parents are drug addicts, whose parents are not there for them, and them being grown up. We tried to get a diagnosis in called developmental trauma disorder, and the response was, after submitting data on 20,000 children with this problem, they said, oh, we don't really have enough evidence for this niche diagnosis. And in fact, vast numbers of people who seek psychiatric care are in fact traumatized human beings. So now we live with weird diagnoses like oppositional defiant disorder, where people don't ask why did these kids become defiant, or conduct disorder, that these kids behave strangely, with bipolar disorder, kids being mentally unstable, going up and down in their emotions. And psychiatry doesn't really want to look at what's behind there. And as a consequence, instead of looking at social conditions as being at the origin of these disorders, these kids get drugged up. Last year in the US, kids got $18.1 billion worth of psychotropic drugs. And these drugs actually do calm people down, but they also work on the reward system in the brain and decrease curiosity, openness, experimentation, engagement with people. And I am extremely concerned that all these medicated children in America are likely to grow up having a deficit in their capacity to engage, a deficit in the capacity to learn, to be original, to be engaged, to be a useful member of the workforce. So the neglect of the issue of trauma in the US in particular is a very serious public health issue.